People often ask, what is a body-focused repetitive behavior? And the two terms that we use currently in our diagnostic manual are excoriation and trichotillomania. Big words, I know, so let's break them down. Trichotillomania is hair pulling and excoriation is skin picking. Now, why might somebody continuously pick at their skin? And if you are someone, you've already raised your hand saying, I know, because some people really dislike if there's any bumps on their skin. They can't stand that there's a scab or a blackhead or a zit. And after a while, by picking at these things, they might actually grow and get worse. And then you have to pick at it more and more, it feels like, in order to get the loose skin off, or maybe it feels like you're doing your own form of microdermabrasion on yourself in order to try to smooth this out. But it doesn't quite get where you want it to go, so you keep doing it. And that's where people often feel stuck. Now, what can skin picking be a sign of? Again, this diagnosis of excoriation, or this body-focused repetitive behavior, which we also call a BFRB. What happens? Why might we do this? What is the purpose of skin picking? There's a lot of debate about that. Some people state that there's a bit of an endorphin rush when you do this. Others say it's just a habit that we do when we're bored. We might not even notice that we're doing it until we look down and we see that there's a large area of red on our skin and there's flakes of skin that are off, maybe some even on our pants or on the floor, or on the chair, or something of that nature. And then we're like, oh, geez. And now we got to go deal with it. We got to fix it. We got to try to do something to heal that wound, or else it might just grow and it could get infected. And nobody wants that. Nobody's looking for an infection. But there are things that people might just be getting out of it that they don't even notice it. Same thing can go for people who pull their hair. There are times that they look down and there's a whole bunch of hair sitting in their lap. They maybe just pull their hair when they're bored and don't even realize it. How do we treat it? Well, the first thing that you want to do is create awareness of something. So I might have somebody put a Band-Aid on their finger. So if they go to scratch at their skin, they no longer feel the thing they typically feel. They feel the Band-Aid on their skin and like, oh, awareness, wait, hold on. Oh, I'm not supposed to be doing that. Pull it back. This is all part of a treatment that we call habit reversal training, where we train people to get out of a certain habit and do something else instead. This is ultimately what we want people to do. We want people to do the opposite behavior of what they've been doing. So if they've been picking at their skin, we don't want them to do that anymore. Now, different from exposure and response prevention therapy, in habit reversal training, we might introduce some intermediary things, maybe a koosh ball or something to scratch on or to pick at, so that the skin can start to heal, and then slowly and gradually we can move people away from pulling at that koosh ball or that pad or whatever it is that they might be scratching on. And we're going to have people practice just being able to sit and not touch things with their hands. There's all sorts of stuff out there for this now too. There's bracelets that people can wear, and you can program that if your hand is in a certain position, it will buzz your wrist a little bit. Not a shock, but it would just give a buzzing to bring, again, that awareness that, oh, my hand is not supposed to be there. I need it to be somewhere else. Ultimately, we want people's bodies to heal. We want hair to grow back, because there are people who have pulled out so much hair that they're almost bald. And it isn't just hair on your head. It could be arm hair, leg hair, pubic hair, armpit hair. Anywhere that hair grows, there are people who could pull it. Even to the point sometimes with hair pulling that they might even eat it. And at its extreme, you can create what's called a trichobazar, or a human hairball. And guess what? Humans can't get rid of hairballs, so it's a surgery to get it out. That's the extreme that some of these behaviors can go, and we don't want to see that happen. If you're looking for help in this, if you have someone you know, or you yourself are picking at your skin to a point where it feels that it's impossible to stop, or you're pulling your hair and you're seeing bald spots and you're having to do all sorts of things to try to cover them up, help is available. Check us out at NOCD.com, where we have expertly trained therapists who work with body-focused repetitive behaviors. And we have therapists trained in habit reversal training so that we can teach it to you, so that you can stop the effect of BFRBs on your life. Again, NOCD.com, and we look forward to hearing from you soon.